Okay, sorry. Okay. Okay, so today we're having the exit meeting with the auditee today, and today we've got, it's the 4th of the 4th. Today we have V, who's doing the minutes, Jody, and Val, the auditee, and we're just going over the report that we did for the National Safety Quality Health Service Standards, Standard 2, partnering with consumers. Val's got the report already. Okay, now, off the bat, just to read you the summary. I would like to thank all the audit participants for their assistance and cooperation, which has enabled the audit to run smoothly and to schedule. The audit objectives have been achieved and the certificate scope remains appropriate. The audit team concludes, based on the results of the audit, that does fulfill the standards and the audit criteria is identified within the audit report, and it is deemed that the management system continues to achieve its intended outcomes. The audit team recommends that ATSICHS Mackay considers the information found in the audit report as evidence in part of the conformity of Aboriginal Torres Strait Islander Community Health Service Mackay Limited with requirements for the National Standard 2012 Standard 2. What I said, the standard we audited. ATSIS is an Indigenous community-controlled organisation with a formalised community engagement strategy reflective of the values and missions as identified in the Strategic Plan 2016 to 2019. Performance targets detailed service user feedback that inform the board and management, service planning and increase in community knowledge of the services. As well, a well-established partnership program is in place with the external organisations to meet, identify and assess community needs. Okay, so that's just a quick background of what we just went over. I will bring up next item, which is we did identify a car in Jody's section. Jody, do you want to just go over your point quickly?
Yeah, sure. So it was under 2.5, partnering with consumers and or carers to design the way care is delivered to better meet patients' needs and preferences, particularly 2.5.1. Consumers and or carers participate in the design and redesign of health services. So my notes on that was basically unable to confirm feedback through documented evidence or meetings regarding the need for the new cultural hub and why it was implemented for the extended community to identify as a meeting place for all areas and all Indigenous cultures. There is no evidence of discussion around the area, no implementation systems followed. It is obvious this is needed and the community wants it, but there is no hard evidence of this being the case due to auditee unable to provide the information it was modelled off.
Okay. So that was for car number 1. We only found one car,
Yeah.
and that's where it reflects and cross-references car 1. So, and we were all in agreement, we all sat around and this is what we identified. Are you happy with what we found?
Yes, very happy.
Okay. So next we're just talking about the improvements that we thought would help you improve in this area. And what we came up with was just a staff refresher on documented communication, feedback policy to have a rigid review and coordinate to demonstrate evidence-based record keeping. So just make sure in your feedback policy that it reflects how you use that feedback and where you see it and what the next steps are, etc. Plan.
Yep.
Senior manager to ensure documentation is developed and delivered all the way to top management for implementation. So again, you've got your feedback report, goes all the way to the board and we can see it at the meeting minutes and stuff and see where it reflects it. And how the community told you at the top, this is what we need and this is what we need to implement the other way. How you're doing it. You use your new, I think we've seen the new program policy that you have here, so just like that. Are you happy with those suggestions?
Yep. Yes.
Okay, so what we need to do now is we need a timeline for your corrective actions. So I suggest that in 2 weeks' time, when you have that done by, that'll be the 28th of the 4th. Is that okay with you? Do you think you should be able to implement them in a fortnight?
Yes.
Okay. And as a team, we'll probably, as the lead auditor, I'll just touch base with whoever you put in control of that and see how they're going about a week's time at the 21st to make sure the progress is coming along. If you have any problems, I'll help you. Okay, so if you're all happy with the car,
Yeah.
we'll leave that alone and we'll move on to the report, the audit actually. What we'll do, each auditor will go through their criteria of the audit and they'll just read it out and what they found so you understand the findings. And if you have any questions, by all means ask.
Thank you.
So we'll just go through that. And I'm first, so I'll just start. I'm just going to drink. All right. My mouth is dry. Okay, so this will be National Standards Report, Standard 2, partnerships with the community. And this is 2.1, establishing governance and structure to facilitate partnerships with consumers and carers. So 2.1.1, consumers and all carers are involved in the governance of the health service organisation. So what we found was ATS-ICHS is an Indigenous controlled community. The strategic plan dated 2016 to 2019 states to deliver a quality and appropriate primary healthcare service to our region or community. The Aboriginal and Torres Strait Islander people, the people of the Mackay region, and to work in partnership with the regional community and other health providers to ensure services are appropriate and accessible for our peoples. It also includes a commitment to the Mackay community, Strategy 3, community engagement for the health outcomes include goals, objectives, key results areas, marketing, promotion and strategies, and performance targets. So you can see straight through your strategic plan, you're committed to the community. Okay, 2.1.2. If you're not happy with anything that we read out, can you just let us know? And if not, we'll just keep moving on.
Yeah.
Okay. Governance partnerships are reflective of the diverse range of backgrounds in the population serviced by the health service organisation, including those people who do not usually provide feedback. Okay. So ATS-ICHS Mackay Annual Report 2015 I looked at. I didn't see the 2016 one. Details the corporate governance statement that identifies board roles and responsibilities and effective manager and board subcommittees. It also includes external representation for relationship management by entering into formal partnerships and agreements, alliances and joint understandings with other like-minded organisations. ATS-ICHS does not discriminate as to who accesses the service delivered to the community or at the clinic, and successfully encourages multicultural members of the community to join the groups, such as healthy lifestyle, I should say. Okay. So we'll move on to 2.2, implementing policies, procedures or protocols for partnering with patients, carers and consumers in strategic and operational services and planning, decision making about safety and quality initiatives, quality improvement activities. So 2.1.1, the health service organisation establishes mechanisms for engaging consumers and or carers in the strategic and or operational planning for the organisation. Okay. The ATS-ICHS Strategic Plan 2016 to 19 informs the mechanisms for encouraging consumers within the organisation. Strategic 3 identifies the goals, that is to increase health and wellbeing outcomes for Aboriginal and Torres Strait Islander community in the Mackay region through community engagement. The objectives are to increase access and improve health outcomes through strong community engagement and increased community knowledge of ATS-ICHS Mackay health and wellbeing service and programs. services and programs. The performance targets detailed service user feedback used to inform board and management service planning, increase in community knowledge of ATSICHS services. 2.2.2, consumers or carers are actively involved in the decision making about safety and quality. As a result of the key performance indicators related to the general community input and reports from community-based programs such as healthy lifestyle, quality improvement initiatives have been established by ATSICHS. Performance targets include service users' feedback are used to inform the board and management service planning and increasing community knowledge of the ATSICHS services. Okay, and the last one for me, 2.3 is facilitating access to relevant orientation and training for consumers and or carers partnering with the organisation. So it only has 1 point, and it's 2.3.1. Health service organisations provide orientation and ongoing training for consumers and or carers to enable them to fill their partnership role. So TIS, Deadly Choice Program, provide knowledge of programs to be delivered and the role of the consumer when partnering with the programs. These teams attend community locations including prisons and inform consumers of their role and how they can assist in the delivery of the program. ATSICHS provides training for consumers and carers to enable them to continue the partnership role and involvement in these programs. A number of brochures are available at ATSICHS, and collaboration client information sheet is available to inform the community of services and programs provided and that the ability of visiting specialists. ATSICHS Facebook page invites consumers and consumer involvement in various programs and provides education to consumers relating to their programs and involvement. So more